Recording in progress.
I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. 2 weeks ago, I shared the good news that COVID-19 cases and hospitalizations in Ohio had dropped significantly. And today, I'm happy to say that those downward trends have continued. In the heart of the Omicron surge in January, Ohio at times experienced more than 20,000 new cases a day. And our rate of statewide cases per capita reached more than 2,200 cases per 100,000 residents. Today, those numbers have fallen dramatically. Over the last few weeks, we're averaging around 2,800 cases a day, and we've recently had several days with less than 1,000 cases. Overall, our statewide rate now stands at 174 cases per 100,000 residents. That's more than a 90% drop from Omicron's peak. And where once there were more than 6,700 Ohioans hospitalized with COVID-19, as of yesterday, there were 1,345, the lowest level of hospitalizations we've seen since August. Last week, Cuyahoga County, which was once an epicenter of the Omicron surge, became the first county to fall below 100 cases per 100,000. And that's significant, as the 100 case mark is what the Centers for Disease Control and Prevention considers high community transmission. Since then, 8 more northern Ohio counties have fallen below that mark: Geauga, Holmes, Lake, Lorain, Ottawa, Sandusky, Stark, and Summit. As you recall, northern Ohio was the first and hardest hit area during the Omicron surge, right on the heels of the Delta wave. At one point, the Ohio National Guard had 2,000 members deployed at 62 facilities and 18 testing centers all around the state. On Tuesday, exactly 2 months after their mission began, Guard members left the last 2 facilities they were supporting. It was an incredible effort and had extraordinarily beneficial impact on hospital operations, and we sincerely thank the Guard members for their invaluable service. This is all wonderful news, and it's a welcome relief for us. It may be especially meaningful for those in our hospitals who've been working so hard now for nearly 2 years. Let's keep in mind, however, that while we are steadily headed in the right direction, Omicron is not quite done threatening us yet. The CDC considers 50 cases per 100,000 residents to be a sign of substantial community transmission and recommends continued prevention measures above that threshold to help prevent further spread. All 88 of our counties remain above that threshold. The fact is that COVID-19 is still a real presence in Ohio. And as much as we look forward to declaring that we're in the all clear, the data still point toward caution and tell us we're not quite there yet. As we move forward then, it will be vitally important that people make informed decisions when it comes to prevention and mitigation, especially considering the COVID-19 rates in their community, since those rates currently vary substantially from community to community. As schools, organizations, and businesses begin to consider easing their mitigation efforts, they should take into account conditions on the ground in the communities they serve. And their local health department is a very good resource for understanding those local conditions. But the onus is not just on institutions. In order to keep COVID-19 at bay, each of us over the days and weeks ahead needs to look carefully at what's happening in our community and the recommendations of local public health leaders there. And regardless of whether COVID-19 transmission is high or low where we live, we need to remember that, like so many other respiratory viruses, SARS-CoV-2 may fade, but it won't disappear. COVID-19 will be back, and we need to be well protected when it returns. First and foremost, getting fully vaccinated and staying up to date on your vaccinations remains your most reliable defense. Statistics show that those who are vaccinated and boosted have a far better chance of avoiding hospitalization than those who aren't. And now, recent studies have suggested that receiving a booster may provide a high level of protection for a longer period than was previously thought. It now appears that receiving a third dose of either the Pfizer or Moderna vaccine boosts the ability of our immune system's B and T cells. Unlike antibodies, which naturally fade fairly quickly, B and T cells have long memory and provide robust protection that includes new antibody production. And this cellular immunity can last not only for months, but possibly for years. For this reason, national officials suggest that our current vaccine boosters deliver a wider variety of antibodies and a richer pool of B cells, which make them much more likely to be able to provide the kinds of benefits that we're seeing from booster shots. To date, more than 6.6 million Ohioans have completed their initial vaccine series, yet only about 3.3 million have received an additional dose. That leaves several million people who are likely eligible, but missing out on the potential benefits of boosters. And while many of us are tired of wearing a mask, until COVID-19 cases drop a bit further in most parts of the state, it's still a good idea to mask in crowded indoor settings. This is the CDC's recommendation, even for those fully vaccinated, if you live in an area with high or substantial transmission, which again, still describes our entire state. If you want a mask that offers some added protection, the good news is the federal government has shipped N95 masks to a number of pharmacy chains in Ohio for free distribution. Testing, of course, is also an important tool, and the state's supply of rapid tests continues to grow. They once again are available in many libraries and community centers statewide. In fact, we now have distributed more than 2.5 million tests through 450 library locations. All of these measures take on added importance if you're in a category that makes you more vulnerable to serious illness, or if you're going to come into contact with someone in one of those categories. The efforts we're talking about today are not just about protecting yourself, but also protecting those around you. People who are particularly vulnerable to COVID-19 are the elderly, people living in congregate care settings, those with disabilities, the immunocompromised, and people with chronic health conditions. Among the chronic health conditions the CDC includes in their list are heart disease, diabetes, obesity, physical inactivity, and smokers, both past and present. Now, joining us today to talk about the next phase of this pandemic and how we cope with COVID-19 is Dr. Joe Gastaldo, Medical Director of Infectious Diseases at Ohio Health. Dr. Gastaldo, with the case numbers rapidly declining, are you at all concerned that people might let their guard down a bit too soon? And what is your message to people, many of whom are tired of dealing with COVID-19 regarding why they should hang in there a little longer?
Well, first of all, thanks for having me again, Dr. Vanderhoff. It's my honor to be back here speaking to this group. At Ohio Health, I will share and just to give you guys some statistics. As a healthcare system, we do a lot of COVID testing, and our positivity rate and our COVID patients in the hospital has also come down to the point we are at the same level of where we were back in early August of 2021 at the beginning of the Delta surge. So we have made great progress into getting cases down lower in the community, getting hospitalizations down, but this virus is still here. And I am concerned that people will hear that COVID-19 is no longer consequential. And obviously that is a dangerous statement to make moving forward. People need to still remain vigilant, and the degree of vigilance really needs to be taken down to an individual context. Like, what is the COVID activity in your community? Do I have an at-risk condition? And most importantly, am I up to date and current on my COVID-19 vaccinations? And moving forward, we need to realize that we have the tools available today, and we need to ensure that people understand the messaging on the tools available, like vaccines and the oral antiviral medications.
Yeah, Dr. Castaldo, staying up to date on vaccinations has really proven over the course of this pandemic to be vital. Can you discuss some of the latest emerging data on booster shots and their efficacy?
Yeah, again, a great question, Dr. Vanderhoff. This is what we know really based on how vaccines perform in the real world, the vaccine effectiveness. If you look at data provided by the Centers for Disease Control and even at each individual state's website on hospitalizations, and even here at Ohio Health, still the predominant people in the hospital are those who are not vaccinated. The second group are people, specifically elderly people, who are not up to date with their vaccination. Specifically, they have not received a booster. But when it comes to what matters the most, how do the vaccines perform in the setting of offering a layer of protection against hospitalization and death, getting a booster shot, especially for those who are elderly and those with at-risk conditions, is of a paramount importance.
So let's just consider that group of people who are perhaps more vulnerable to this virus. Family members and individuals themselves, I'm sure, worry a good deal about, what about the long-term view? What practical advice might you have for people who are in those vulnerable categories and for their families?
Yeah, so, there are many high-risk conditions from COVID-19. Dr. Vanderhoff mentioned a lot of them, and it really affects a lot of people in my family and people in the general community. And obviously, I think moving forward, we need to get the message about staying up to date on your vaccines. And then most importantly, regardless of somebody's vaccination status, if somebody does have COVID-19 and they are not sick enough to be hospitalized, those individuals really need to understand the availability of the oral COVID medications that we now have available in the state of Ohio. We have these medications at Ohio Health, and we are really trying to partner up with providers inside and outside of Ohio Health to make sure people have access and really know about these medications. I really do a lot of calls with physicians, reaching out to them, educating them about the oral antiviral medications, but I also think it's quite important to let Ohioans know that these products are available for at-risk people who have COVID-19, regardless of their vaccination status, to really give them another layer of protection against hospitalizations or even dying.
Well, thank you so much, Dr. Castaldo. Another group of people we need to be concerned about is our children. Of course, the younger age groups weren't eligible for vaccines as early as adults, so their vaccination percentages are not surprisingly lower. And our youngest children, those ages 4 and younger, are not yet eligible for a vaccine. The FDA review of those vaccines has been delayed in order to study some new data coming in from third dose clinical trials. but we do anticipate that it's highly likely a day will come when they too will be eligible. Joining us now to discuss the effects of COVID-19 in our children is Dr. Amy Edwards, Associate Medical Director of Women's and Children's Infection Control at University Hospital, Rainbow Babies and Children Hospital. First of all, I asked Dr. Gastaldo, are you concerned at all with the cases declining? And this is an important question for parents as well, Dr. Edwards. Parents may not view vaccines for their children as quite as important as they see cases declining. And I'd be interested in some of your thoughts as a pediatrician and some of the messages that you're offering parents as they see the numbers improving across our state.
Well, first, thanks for having me, Dr. Vanderhoff. It's great to be here and talk about this important topic. So you're right. I mean, I don't know that it's so much that parents don't view the vaccine as important. I think when parents are doing that risk-benefit analysis, they naturally view the vaccine as very risky, which is a message I have been educating against over and over and over again. But I do understand, where their feelings come from. And so as the case numbers drop, I think they're feeling like their kid is going to get less benefit from it. And so that imaginary risk from the vaccine really starts to pull them towards not vaccinating. And so my message continues to be that actually these vaccines are incredibly, incredibly safe in children. And I will emphasize, as I have from the beginning, that yes, I am a pediatrician and I am a pediatric infectious disease specialist, but I'm also a mother of a 5-year-old and a 3-year-old. And my 5-year-old is fully vaccinated and my 3-year-old will be vaccinated the instant he can be. Because the data, if you look at the data around these vaccines, they're incredibly, incredibly safe for children. They have minimal side effects, and they're incredibly beneficial. They reduce the risk for MIS-C. In adults, they reduce the risk for long COVID. So they probably do that in children as well. And they reduce the risk of hospitalization and they reduce the risk of long-term complications. The other thing I'm just going to throw out there as a pediatrician, in that very youngest group, those kids that are under a year of age, there are several new studies that have come out that show that if mom is vaccinated while she's pregnant with baby, it provides a tremendous amount of protection for the first 4 to 6 months of life, which is fantastic because the vaccine, once it becomes available, is going to start at about 6 months of life. So you literally can protect your child from before they're even born by getting that vaccine in pregnancy. And so that message around how safe these vaccines are and how much protection they do provide children is one that I just keep pushing again and again.
Well, thank you. Dr. Edwards, that brings us to then a very important question. You've been studying the effects of COVID-19 in children for quite a while now. What can you tell us about the severity of disease in children, and especially the potential for children to develop lasting effects, known also as long COVID?
Yeah, so this has been an area that I have to admit we weren't prepared for in the pandemic. So if you go back and Google some of the earliest press releases that my hospital did, and I even went before the press and talked about how, yes, we need to be worried about kids, but really the focus is on adults, because while kids can be affected, it looks like they're not as affected as severely as adults. And that does actually continue to be true, but there's some things that kind of snuck up on us during the pandemic that we weren't expecting. One is MIS-C. That's that multi-system inflammatory syndrome in children associated with COVID-19. So what happens with kids is they're perfectly fine. They get COVID. In a lot of cases, the parents don't even know the kids had COVID because they're completely asymptomatic. They don't even test them because they didn't even know their kid had COVID. And then about 4 to 6 weeks later, they come down with this severe fever, vomiting, diarrhea, weird rashes, and they end up in the ICU. And a lot of these kids require fairly aggressive ICU care for a number of days. We have to put them on significant anti-inflammatories and reduce their immune function to get them better. And that in and of itself, the MIS-C, can have significant complications. It can affect the heart. It can cause blood clots, which can affect various organs of the body, because when blood clots on its way to an organ, then it can affect that organ downstream. So we are seeing some of that in kids. But then more recently, what we have discovered is that kids can suffer from COVID long haul. And this was something we really were not expecting. And it's a significant number of kids. And they can suffer problems with fatigue. They can suffer from exercise intolerance. So I can tell you about kids who were track athletes and hockey athletes and volleyball players, and now they can't hardly get out of bed. They've had to quit sports. Some of them have had to go back to online schooling because they can't tolerate schooling in person because they're so exhausted. I can tell you about kids who have had memory loss. I can tell you about kids who suffer from severe debilitating migraines, body aches. I mean, it's truly one of the most heartbreaking things that I'm dealing with right now, and watching these kids go through this. And it was completely unexpected. We just weren't ready for it. We have now, opened a COVID recovery clinic for kids, but there's still so much we don't know about it. And so my preference would be for all the kids to get vaccinated, then we just don't have to deal with it anymore.
Thank you. Dr. Edwards, you referenced parental concerns about the potential risks of getting a vaccine. What are some of the most common concerns you're hearing from them about the vaccines for their children? And can you share some of what you tell them about some of those specific concerns?
Well, that's a really great question. And you're completely right that it is some of the same concerns come up again and again and again. Some of it is just natural parental anxiety, and some of it's coming straight from misinformation on the internet. So probably some of the most common concerns, one is that it could affect their DNA, which it cannot. Messenger RNA cannot get into the nucleus of the cell. It cannot affect DNA. That's a lie. I know it's very common on the internet, but it's a complete lie. There's no biochemical mechanism for messenger RNA to even get into the nucleus and affect your DNA. So that's one. The other is fertility. And fertility in vaccines is actually a fairly common anti-vaccine trope. We've heard it before with the HPV vaccine. We've heard it before with the meningococcal vaccine. So this is a common thing that comes up when the anti-vaccine movement wants to really push parents not to vaccinate their children. They pull out the boogeyman of future infertility issues. Oh, your kid might not be able to have kids when they grow up if they get this vaccine. And that's obviously complete bunk, because there's really no way for the vaccine to affect the child's reproductive system. There's no mechanism for it to do that. And like I said, it's a very common claim that anti-vaxxers make against various vaccines. And then last but not least, it's just this vague fear that because the vaccines haven't been studied long enough, that at some point in the future, say 5 or 10 years from now, all of a sudden, all of these kids are going to come down with some mysterious illness that will be related to the vaccine. And that is really just a fear born of a lack of understanding of how vaccines work and how immunology works. Vaccines are only in your body for a very transient period of time, a couple of hours to maybe a day to a day and a half at the most. And so after that, they're gone. The body has processed them and eliminated all the pieces and parts. And so once the vaccine is gone out of your body, there's no way for it to have ongoing effects on the body. So there's no way 5 years from now, mysteriously the vaccine is going to be able to affect your child because it's long gone. And so I think that's just a lack of understanding. And then a lot of parents will say, well, but other vaccines have been studied for years and years and years and for decades. And that's actually not true. A lot of parents think that vaccine trials go on for decades and decades, and that's not true. Again, vaccines are only in the body for a brief period of time and then they disappear. We might retrospectively or looking backwards, look at how immunity lasts from a vaccine 5, 10, 15 years later, but we are no longer studying the vaccine itself because the vaccine is gone. So there's no safety trials that go on for decades and decades. And parents believe that there were for other vaccines, but they're not because they're not necessary. And so it's all about just educating, allowing parents. One of the things I tell providers is to really allow the parents to verbalize their fears so that you can address them just one by one, kind of tick them off.
Thank you so much, Dr. Edwards. Well, Next, I'd like to take a moment and highlight something that has been a real success story for Ohio's response during this pandemic, and that's our wastewater monitoring program. Human beings, of course, shed COVID-19 virus when they use the bathroom, and enough fragments of the virus remain in our wastewater that we can not only detect the virus there, but we can even use genomic sequencing to determine the presence of variants. Ohio began testing its 70 wastewater sites in the summer of 2020. And by that December, we had become one of the first states in the nation to upload our data to the CDC's national database. We've invested millions of dollars into this effort and have partnered with the Ohio State University's Infectious Disease Institute to help us with this. This program is particularly important as we look to the future, because it can serve as an early warning system, identifying a return of the virus in our wastewater, even if people are not yet seeking individual testing for COVID-19 at that time. In fact, we have sent out more than 1,000 alerts to our local health departments statewide based on increases in wastewater surveillance. And we know from feedback from them that that's helped them alert the public and help them get a jump on mobilizing resources such as individual testing, vaccinations, and even contact tracing. The infrastructure we have built around this should continue to yield dividends well into the future. Thanks to this program, even as COVID-19 recedes, we're confident we have a reliable early detection system to alert us if COVID-19 makes a resurgence, even if people at that time aren't getting individual tests done in high numbers. Now, we certainly hope we have seen the worst that COVID-19 has to offer. The Omicron surge is waning, and that's a big relief. As shown by both the Delta and Omicron waves, even after Omicron fades away, it's likely another variant may come along. How we are affected by that depends greatly on how we prepare today, especially by preparing our immune systems with primary vaccinations and boosters. And of course, both of my guests, both of whom are infectious disease specialists, have spoken to that very well. So with that, I thank you. And Ken, I think we could now open up for media questions.
Okay, thank you, Dr. Vanderhoff. Our first question today comes from Joe Ingles, the Ohio Public Radio and Television.
Good morning, Joe.
Good morning. Thank you for doing this. I have a question about the booster shots. We're going into the period where a lot of people are going on 4 to 5 months out with the booster shot, and they're going back to work in situations where they're exposed to a lot of people. And, you know, you think about teachers and schools, you think about all these different professions, you're exposed to a lot of people who may have COVID. And it's more than just the average day-to-day walking out, you know, doing normal things. So is there any exception for people who have a lot of exposure to people who could be dangerous with COVID? And can they go get a booster shot, or do you have to have certain, does there have to be certain qualifications other than that?
Sure, that's a very, very important question. And there's really a lot for us to consider there. And in fact, the CDC provided us with updated guidance on the timing of COVID-19 doses actually just yesterday. So, you know, following a really thorough evaluation of the data, they've provided some updated information to help physicians and help individuals make good decisions about when to get a COVID-19 booster, and even some guidance regarding some of the recommendations around intervals for the primary series. In a nutshell, what we've learned from that information is that boosters are important. They're particularly important for some of the people that you're describing in your question. You know, people who look at their own health condition and say, you know, I really think that I may be at significant risk. And, you know, the first and most important thing is for them to focus on getting that primary vaccine series done. Now, for most of us, that primary vaccine series is a 2-dose vaccination series. For many people, now the CDC is saying, look, that primary series, you can separate dose 1 and dose 2 by 8 weeks rather than 3 or 4 weeks. But it's still a 2-dose series. On top of that, for most individuals, there's a recommendation for a booster, which would be their 3rd dose. Now, remember, for some people, including those with immunocompromising conditions, et cetera, their primary series long ago was expanded to be a 3-dose primary series. And we would, of course, recommend at the appropriate time a follow-up booster. But your question highlights a very important fundamental point. And that is that our best defense against this is to have our immune systems best prepared to win in the battle against COVID-19. And all the data now is telling us that it's much bigger than the question of antibody levels, which naturally rise and fall. It's really about preparing the cells of our immune system. We call them B and T cells, and they have different special functions, but preparing those cells to be knowledgeable, they've seen it before, they're armed, they're ready to go, so that if we encounter the virus, they're well prepared to keep us from getting severely ill. Now, obviously, one of the other pieces of the puzzle is looking at what's going on around you. And we've emphasized that here today as well. What is the rate of transmission in my community? Has it fallen below that substantial to high level, that 50 to 100 cases per 100,000 level? You know, once it begins to fall below that, we're getting to a much reduced risk that you're even going to encounter someone who might be transmitting the virus in your environment. But we do know there are some mitigation strategies that can work very well, especially wearing a high-grade mask like an N95 mask that does a very good job of filtering out the mist that will allow you to transmit or receive this virus. So there's a lot going on there. Now, the good news is I've got 2 infectious disease doctors on with me, and I'm going to start with Dr. Gastaldo because his focus is on dealing with adults, and then turn to Dr. Edwards. So Dr. Gastaldo, what can you add?
Yeah, thank you, Dr. Vanderhoff. I think it's important for people to really understand at this point in time, there is no FDA authorized or CDC recommended booster other than what we have now. And for most people, it's 3 shots. And again, to be transparent with the Ohioans, we need to know that recommendation may change. There may be a recommendation for specifically senior citizens or other people with medical conditions to get a booster later on this year. We don't know that. I do want to acknowledge that 7% of the American population, 3%, roughly 7 million people of the American population are considered immunocompromised. And those people should actually get 4 doses of the vaccine as recommended by the FDA and the CDC. In addition, those who are moderately or severely immunocompromised have access to another prevention. It's a long-acting preventative monoclonal antibody. That's another tool in the box we have for those who are moderately or severely immunocompromised. In addition, I do agree wholeheartedly with Dr. Vanderhoff's comments that if you are in an area where there is more community transmission of COVID-19, another tool in the box is wearing a high quality mask. The higher quality you go, specifically an N95 mask or a KN95 mask, that actually adds a better layer of protection for the wearer in not getting COVID-19. So again, we are now in February of 2022, and the conversations regarding treatments and vaccines and immunology becomes more full of caveats for individuals.
Dr. Edwards, anything that you need to add or think would be helpful?
The only thing I will remind people is on the pediatric side that provision that patients who are immune compromised can get that third shot does go all the way down to age 5. And that is very important for kids who've had like kidney transplants or bone marrow transplants or getting cancer therapy. It is important that you do that full three-shot series for people who are immune compromised. And if you're not sure, I know it gets a little bit complicated. I urge parents to reach out to your provider.
Okay, our next question comes from Laura Hancock with Cleveland.com.
Good morning.
Hello. I am recently, Bexley and Columbus has been considering are removing their mask mandates. And I guess I was just wondering, Dr. Vanderhoff, can you just talk a little bit, share your thoughts about, is this good? I mean, and then you have other states that also are removing mandates or removing mandates in schools for masks. So I'm just wondering where are you at? Like, what are you thinking these days about all of this?
Well, thank you. Very good question. Of course, in my opening comments, I referenced some of the dynamic that we're looking at. Look, the reality is we're in a period of transition. Now, it's a transition in a very favorable direction. That's very encouraging. And we are fast approaching numbers that I think will bring us below that 50 cases per 100,000 that has been used for a long time as the threshold, the indicator that we're below a level of substantial transmission. And even sooner, we'll get below 100, which is that threshold for high rates of transmission. But whether it's a school district or a local health district that's looking at this, the masking policy or the masking recommendations really need at this time to be a local decision, because the rates of COVID-19 as they fall they're not evenly distributed. We have communities that are much lower right now than other communities. Much as when we saw the rise, we saw parts of the state that saw much higher levels before other parts of the state. So it really becomes a very important local decision. And in the case of schools, one that really should be made in consultation with parents and local school leaders, based on the factors that are brought out by the local case data. The other thing is that while Ohio is experiencing this very steep, very rapid drop in our COVID-19 cases as we're emerging from this Omicron surge, it's important to recognize that at this moment, as we're sitting right here, right now, our statewide numbers are certainly above that 100 cases per 100,000 level. And indeed, when we look at the 50 cases per 100,000, every county is still above that. Now, it's rapidly declining, and the picture literally will change day by day. But this really becomes a matter of informed, thoughtful decision-making made by the people who are involved. So if there ever was a time for a good, responsible, individual thought and decision-making about how we're going to approach things, this is it. And if there ever was a time for communities to be acting as communities, this also would be it, because the picture is just different wherever we go. Let's also remember during this time of transition that the risk, as we've said now repeatedly this morning, is not the same for every individual. So as you're looking at your personal situation, even as communities may no longer recommend or be seeing the need for mitigation steps like masking broadly, it's perfectly acceptable as you are looking at your own medical situation to say that you may choose to continue wearing a well-fitting, high-grade mask, like an N95 mask, when you are going out in public, especially in indoor crowded situations. And I would anticipate that there will be members of our community who, for some time, will continue to make that personal decision, even as many of the rest of us have made a decision that we're comfortable reducing the mitigation efforts that we're undertaking. Again, I've got two infectious disease docs with me, and this is their area of expertise, and let me turn it over to them.
Thank you, Dr. Vanderhoff. I'll start off, and I just want to dovetail on your comment too. We have to understand that it is going to be normal now moving forward to see people wearing masks in public. There are people out there who have at-risk conditions, immunocompromised patients, transplant patients, those on medications that weaken your immune system, and there are many Ohioans in that category, and we need to recognize that. Second thing is, we have to realize too that moving out of this pandemic, I hope we stay in the mindset that if you're not feeling well, stay home, get tested, and take care of yourself. That is something that I hope culturally is going to be more acceptable that we do. And as an infectious disease doctor, obviously there's COVID, there's influenza, there's a boatload of other respiratory viruses, and we really need to change that culture. If you're not feeling well, stay home, and please don't go out there and potentially expose people to whatever it is you have that you're suffering. Obviously, too, we also have to be cognizant about people who don't have any medical conditions, who have family members who have at-risk conditions. So we always have to be sensitive to the immunocompromised people. I have a soft spot for them, an infectious disease doctor, but we really have to make sure that those people also have the wonderful layer of protections that they need.
Yeah, and I'm so glad you mentioned that, Dr. Gastaldo, about thinking about some of those other viruses. And staying home when you're sick. One of the things that I think a lot of people don't realize is that it's kids that drive flu outbreaks every year. So I'm a pediatrician, right? I'm a pediatric infectious disease doctor, and it's my patients that drive influenza outbreaks every year. So when the sick and the elderly are dying of influenza year after year after year, believe it or not, it is actually children who are driving those flu outbreaks that are affecting people. And for the last 2 years, as we've been so cautious with our kids and we've been strict about keeping them home when they're sick, and if they've got the sniffles and they absolutely have to go out, we put masks on them, and we don't let them go to school with fevers or runny noses or coughs. We've really been able to keep those flu outbreaks pretty dramatically under control. It's been a massive change from prior to 2 years ago. And I know that for some working parents, it's not always very easy to keep kids home when they're sick. But honestly, it's better for the kid. It helps them get better faster. It helps their immune system fight off those infections faster if they're able to stay home and rest. And it helps keep community spread down of all of these respiratory viruses. And so I think that's one of the key things that schools and daycares put in place at the beginning of this pandemic and have been really strict about for the last 2 years that I hope will carry forward in the future. And I hope the community will help to look at ways to support parents in being better able to keep their kids home because that's made a real big difference.
We have a question that was posted in the chat, but we certainly have time if she wants to ask it now from Stephanie Chekalinsky of IdeaStream.
Good morning.
Hi there. Hello. Sorry. That wastewater detection system, are you using it to detect other infections or outbreaks besides COVID, or right now it's just set up to look for COVID?
Well, thanks. It's a very astute question. We developed it and implemented it with a focus squarely on COVID-19. But I can tell you that your question is a very good one, because that's exactly the direction our work and our minds have turned. This technology, this capability really is applicable to a host of infectious diseases that tend to create outbreaks in communities. And we are actively working to expand those detection capabilities to include not only a variety of viruses, things like respiratory syncytial virus, RSV, that you, I'm sure, heard more and more about, that can affect our children very significantly, especially typically in the winter months, but also some bacterial illnesses, some of these foodborne bacterial outbreaks, that it would be very helpful for us to know something is going on, maybe before there are even enough people who are presenting to hospitals as ill, because that gives us an opportunity to go into that community with the local health department and act even more quickly, hopefully, thereby substantially reducing the number of people who unnecessarily become ill from some bacterial cause, often a foodborne transmission. So yes, we are actively looking to expand this and to do so fairly rapidly.
I want to thank all of our guests today. And Dr. Vanderhoff, do you have any closing remarks?
Well, I want to thank all of you again today. I want to thank my guests. And I want to, again, express both real optimism as we're looking at these numbers coming down very rapidly and moving in a favorable direction. I think we're very close to being in a place where we can confidently look at our state and increasingly more and more of the counties and communities in our state and say, you know, we finally reached a level that is below substantial transmission of this virus. So the end is in sight. It's approaching very fast, but I do think we need to be very thoughtful about looking at this, the numbers in our own community, turning to some of our local experts, including our local health departments, for guidance regarding where the community sits, and to have thoughtful conversations within our families, within our schools, within our communities about the next steps for us as we transition, hopefully, to having COVID-19 and the Omicron wave be part of our past and not our present. So thank you all very much.
This concludes today's press conference. Thank you again for joining us.